Thank you, Mr. Chairman. I appreciate having this hearing. And I want to, first of all, in addition to having an opportunity to have a hearing like this, which is an oversight hearing, which is important for us to do, I want to thank Deputy Assistant Secretary Smith for her work and her leadership. We're grateful you're here. We had a number of reasons to be positive about the reauthorization. Just the fact that it had not happened in so many years was reason alone to be optimistic and to be positive. But some of the basic features of that legislation, the 12-month eligibility provision, which was a major focus and priority of mine, so that states are now required to provide for a 12-month eligibility period so that families don't lose access to care if they have a change in some in the family has a change in their working conditions. Of course, the health and safety provisions were critical, and Senator Isaacson talked about that, and others have as well. And the necessity of training as part of that, both pre-service training and ongoing training in at least 10 specified health and safety topics. So among the many things we can be positive about, we still face this major challenge, though, of resources, and it's one that I think folks are in the advocacy community, and I think folks at the local and state level, and I think the Democrats and Republicans here in Washington are concerned about. We need to get more support for more resources, as simple as that. We know that less than 1 in 10 eligible children nationwide under the age of 4, it's not all children who receive child care, but under the age of 4, only 10% eligible are receiving child care assistance. In Pennsylvania, even when we have robust state investment, the number in Pennsylvania is just 15%. So we've got a real problem with very young children being eligible, or not, very young children who are eligible not getting the services. So as much as we can be positive about the bipartisan nature of this legislation and the good work on oversight that we're doing, we've still got a major resource problem. We know that and this is according to Child Care Aware, in more than half the country, it's hard to comprehend this, in half the country, a year of child care costs more than a year of college tuition at a public school. That's how grave the challenge is with regard to a resource deficit and a major challenge that these families have. We also know the median wage for child care workers is $9.30 an hour. So we're literally paying these workers in whom we trust so much of our confidence and in whom we entrust our children to. They're making less than parking lot attendants in the United States of America. So we got a major challenge there. So I guess the first thing I'd ask is the funding gap and what you think we should do about it and what you hope we would do about it.
Well, I do think there is a serious gap in funding in this country. As I said in my opening remarks, the average value of a subsidy voucher right now is $4,800, which if you look at the national averages for an infant, that's about half of the national averages. And in many cases in our bigger cities, it's much more expensive, as we've talked about. So we do have a gap, and we are going to, as a country, have to figure out how we're going to close that gap at some point. Low-income families simply cannot afford what it costs to access high-quality child care in this country. And so there is a gap. That's why we put in our budget proposal this year, our budget request, the $82 billion over 10 years. That would close that gap. I want to add one thing here, too, which I think is very important in this conversation. One of the things that we have learned, and thank you to this body and the House for supporting our early Head Start child care partnerships. because the investment there is demonstrating that when we invest in high-quality infant toddler child care and raise the rates that we're paying to those providers, we are getting high quality. It's amazing what's going on around the country through the partnerships where the Head Start programs are working in partnership with child care providers serving infants and toddlers and paying them to do the same level of work that we expect in Head Start. That is, it shows and it demonstrates that with the resources, we can get there in infant toddler care in this country. That was we're investing $635 million in that right now, and that investment probably is the most important investment that we are making in terms of demonstrating how to do this. So that gap, which is what we're talking about here, and the $82 billion, and thank you for introducing the legislation, because that would close that gap for roughly all children under the age of 4 be at 200% of poverty or below. That would be a huge investment in our future in this country.
Well, I appreciate you working with us on that legislation and also focusing on both access as well as quality. So thanks very much. Thanks, Mr. Chairman.